Perioral dermatitis, also known as periorificial dermatitis, that pink rash around the mouth and sometimes even around the eyes. We're going to be talking about it in this video. I'm Dr. Shah.
Dr. Maxfield.
And welcome back to our channel, Doctorly, where we talk about all things skincare and also dermatology. And in this video, we're going to be talking about all things perioral dermatitis.
Right, so this is an extremely disruptive rash. This is something that is very debilitating for people, even though it looks fairly subtle. But we'll talk about all the things perioral dermatitis. Here we go.
Here we go.
I wonder, is this something you have ever experienced?
I have not.
I have, once. It was a miserable
I could have it right now.
life.
It could be under my beard. I wouldn't know.
He would know.
I actually wonder sometimes, if you go back to our older YouTube videos, I talk a lot about a rash I had on my eyelids that refused to go away. Sometimes I wonder if that was a manifestation of the ocular form of periorificial dermatitis.
That's a good question. I think so. From a patient perspective, it's one of those things that you're like, what's going on? It's a very difficult thing to pin down if you've not been exposed to it before and aren't familiar with it before. So when I had it, I actually had no idea what was the cause. All I knew is I had this burning sensation around my lips, not immediately adjacent to my lips, but around my lips and around my mouth that was just red, raw, aggravated, irritated. So like I kind of mentioned, this is what it looks like. You have a rim of red erythema around the lips, sparing the skin immediately adjacent to the lips. Now, this is actually a distinguishing diagnostic feature that determines that it's not Licklicker's dermatitis, like this picture here, but again, is perioral dermatitis, completely separate condition.
Yeah, so it can be confluent erythema, meaning it's like all joined together redness around the mouth, or it can be like individual papules or individual bumps that occur. And that can almost look a little bit like acne, except one of the key differentiators here is that there will be no pus in these bumps. You can't pop these and get any pus out of them. They can be bumps, like individual bumps around the eyes and around the mouth. They can sometimes be itchy, sometimes they can burn, and sometimes they can have no symptoms at all. And they're just irritating, and nothing you put on them seems to make it go away. Now, the question is, what on earth causes this? We're going to tell you a bunch of things that have been shown to trigger perioral dermatitis, but this is one of those scenarios where doctors need to admit that we a lot of times do not know what is flaring a condition or really even what the underlying condition is. For a long time, we considered perioral dermatitis to be part of rosacea, and now we have separated these two conditions out, and we still are unclear what causes perioral dermatitis in most people.
It's kind of crazy, but there are so many conditions in medicine like this. There are some of the things we think are associated with it, maybe not directly causal, but are associated, may aggravate it. Toothpaste, whether it's cinnamon flavors, the minty flavors, whether it's the fluoride, that's one of the first things you'll hear from a dermatologist to avoid if you're trying to get a handle on this. Another thing that both can be a trigger and can also treat it is topical steroids. So if you're using something like fluocinolone, hydrocortisone around the mouth, and then you develop this rash, it may have caused it. However, if you have this rash and then you get prescribed hydrocortisone or fluocinolone, it may be treatment, but we'll talk about that more later too.
So this is the major trick here. So this is a common thing where somebody will say, well, I had a rash around my mouth, I put hydrocortisone on it, and it got better at first because hydrocortisone will get rid of almost any redness almost immediately, but then it flared worse. So this is one of the hallmark signs of perioral dermatitis that a lot of times steroids either make it worse or start it in the first place.
And then other causes, perhaps just aggravating features of life, whether it's the environment, changes in the weather, humidity, even hormones. So you do see this kind of fluctuate, especially with women as their hormones change throughout the cycle. This can be aggravated by many things, but there's no one clear cause, which actually makes it more difficult to treat.
Right. So it could be UV exposure. So some people get this with worsening sun exposure. Some people get this with wind and cold exposure. So skiers can often get this. Some people get this related to pregnancy. Some people get this due to Demodex mites on the skin, which is why some people thought there was an overlap with rosacea, irritating ingredients in skincare products, sometimes chemical exfoliants, sometimes retinoids. So there are many different triggers, and we will list all of these here so that you know what the things that have been associated with it. And sometimes eliminating these things is going to be your first step when we talk about treatment.
Right. And so I guess let's go there with treatment. So treatment and avoidance. This, if you go with the toothpaste route, this is actually a very difficult thing to do. It is hard to find a toothpaste that does not have a mint or cinnamon in it. I think one I've recommended is Tom's strawberry toothpaste. If you have children, you probably have this somewhere in your house, but Tom's strawberry toothpaste does not have any of those minty associated ingredients. Tooth powder also still exists. For those of you who were around in the time of tooth powder, it's making a comeback in the perioral dermatitis community. This is often like a bland way to brush your teeth and is acceptable here as well.
You can also use a miswak, which if you are from the Middle East in any way, is a branch of a tree that they use as a toothbrush ultimately. So you could use that instead.
Where do you buy that?
The store.
Amazon?
I don't know.
Okay.
So in addition to your toothpaste changes, you're also going to want to stop using any topical steroids that you were potentially prescribed. You also want to stop your irritating skincare ingredients. So your exfoliating acids and your retinoids, you want to temporarily stop those. And then we have a few options over the counter that you can try. And if those fail, then you want to go get a prescription treatment. So when it comes to over the counter ingredients to look for with perioral dermatitis, azelaic acid is a great option for you here. You can also try ivermectin over the counter, 0.5%. So now they have a lice treatment over the counter that is a good option to start in this area. So this is going to be used off label, but we prescribe a 1% version of this in the office, and you can get 0.5% now available over the counter for someone who wants to try something at home.
And if you're over the counter and you've tried those things, then you move into the prescription world.
I have one more thing I want to suggest. Now, it's something that I've seen work in my patients, especially in those who find that their environment is triggering this condition, whether it's a CPAP machine or it's a face mask because they're a healthcare worker, is a zinc oxide barrier cream. First of all, zinc oxide in general is really good and reparative and anti-inflammatory on the skin barrier. This is why we use it in diaper rash. It's something that can help any really irritated skin barrier. So trying a zinc oxide barrier paste at home is actually going to be quite helpful for you. Now, in the process of looking for diaper rash creams for my child, I've done a lot of ingredient research on all the different types out there. I think probably the best option for this would be to actually use the Desitin in the blue. And I think it's like 12 or 13% zinc oxide. It's their daily one. That one has a good amount of zinc oxide in it, but it also doesn't have a lot of the irritating ingredients that you can find in some other barrier creams.
Yeah, for some reason, the butt paste creams always find a way to put something irritating in them. So that's a good one to pick. I also, early on in my kids' lives, took a lot of time to figure out what was like the best butt paste cream, which are the zinc oxide barrier creams. So that's a good one.
Aquaphor 40% also is another good option.
Okay, anything else?
That's it. That's all I have to say. I've done a lot of research on this.
Now, moving on to prescriptions. This is actually probably where most people get the most immediate relief. And topically, you can do something like metronidazole, which is your classic treatment for rosacea. Oral, you can do 15% azelaic acid, which is a prescription strength. And then oral doxycycline. How this works, you're not actually trying to treat the bacteria necessarily with doxycycline. This is an antibiotic dermatologists use a lot, and not often and not always for the antibacterial properties. Even at a lower dose, there are strong anti-inflammatory properties that are unique to doxycycline, and that's actually the role of this ingredient here.
Right. So I would say that I've tried a lot of things to treat my patients with perioral dermatitis, and a lot of them include topical cream. So sometimes I'll do like a combination prescription cream. I'll take metronidazole plus some ivermectin in it, plus a little bit of tacrolimus in it, right? Something that's anti-inflammatory, something that's going to, really treat the root cause of it, right? And in some patients, they get relief, but what I'll find universally to work is the oral tetracyclines like doxycycline. And so in a lot of my patients who have resistant perioral dermatitis, getting them on doxycycline, even for a short period of time, can really knock it down. And even in some patients, I'll tell them to use it for flares. So use it for a few weeks when they flare, and then once it calms down, they can go back to using the topicals to keep it under control. So I do find that it's probably, in my opinion, the most effective treatment for a really acute flare of perioral dermatitis.
Yeah, and then with all of these, just know that it takes time, especially if you're going the topical route. Not only do you need to eliminate things, I say, for at least a month to get a good sense of if it was the cause, but even with the topical treatments, at least a couple weeks. Doxycycline, I feel like, is a bit sooner, but it's not an overnight cure or an overnight fix no matter what you do.
Now, when you look up perioral dermatitis online, you're going to see a lot of different things that people tried, and it's always worth trying things that your friends have tried or the Facebook group has tried. But the reason why you'll see a lot of home remedies and hacks and different things that people have tried for this is because it is one of those conditions in dermatology where we don't always know what causes it, and you have to try a few different things to find out what's going to work for you as far as treatment. So that's the limits of our knowledge right now. Hopefully we learn more about perioral dermatitis as time comes on, so we can figure out exactly what's triggering this, what's causing it, and essentially how to treat it going forward. So try some of the things that we mentioned in the video. If the over-the-counter options fail, or it's just getting really frustrating to you, because I know this is so frustrating for some of my patients, it just comes out of nowhere, it sticks around, it can ruin your week, it can ruin your month. If this is you, see a dermatologist. There are a lot of treatments out there, and they eventually can get it out of control. And maybe one day, Dr. Maxfield will launch a script for perioral dermatitis.
Anyways, that's perioral dermatitis, a condition that I know many people struggle with. Many people don't know they have it. So if you see someone, we've said this before with our medical videos, I don't know if this is like the right thing to do, but if you see someone who has this condition, maybe gently nudge them in this video's direction. Maybe it'll help them out tremendously. You don't know.
You can check out our link. It will take you to Skinpedia, and we'll have a summary of basically everything that we talked about in this video if you'd rather read than watch the video. Too bad we put this at the end of the video because now you've watched the video and you have to read. So we'll see you all next time. Please like, comment, and subscribe. And thank you all for your trust and support.
Yeah, we'll see you next time.